Bismillah ar-Rahman ar-Rahim. This is the bone data show presented for the first year students in the medical school. This picture demonstrates the decalcified compact bone, and as we see, the center of the bone, number 1, is filled with the bone marrow, and the number 2 is the decalcified compact bone, and number 3 is the attached skeletal muscle on the surface of the bone. You may be asked in this section, what is the method of preparation? This method will be the decalcification method by addition of nitric acid 10% to remove the calcium and making the tissue soft and fixed and stained. And in this section we can see any living tissue as the bone cells. This picture is a light microscope picture for a transverse section in decalcified compact bone. Why it is decalcified? As it is stained. In this photo you can diagnose this skeletal muscle, transversely cut skeletal muscle fibers attached to the surface of the bone, while this ribbon here is formed of the decalcified compact bone. In the inner side here you can see the bone marrow. First, the bone marrow is diagnosed by the presence of these empty spaces representing the fat cells, and these dots are representing the hemopoietic tissue. The skeletal muscles are diagnosed by these polygonal cut transverse fibers, and you can diagnose that the nucleus is peripheral in position. And this middle area of the ribbon of the decalcified compact bone, in this ribbon you can diagnose the following. You can diagnose these Haversian blood vessels. Here we have the Haversian blood vessels, this one and this one. All of these are the Haversian blood vessels. If you have a label for these small dots here, these are the osteocytes present in their lacunae or osteocytes in lacunae. So in this area we don't have except these Haversian blood vessels. If you have a label for this transverse blood vessel, it is an anastomosing vessel between two Haversian blood vessels. After that we have these dots that will be labeled as osteocytes in lacuna. This picture on the right side demonstrates the decalcified compact bone as it is stained, and this label here will be the Haversian blood vessels. Why I say Haversian blood vessels and not Haversian canal? Because the decalcified compact bone section does not contain except the living tissues, does not contain calcified tissue, so you should say Haversian blood vessel. If you have a label for these dots, these are osteocytes in lacuna. If you have a label for this area here in between the circular Haversian systems or osteon, this area in between is called interstitial lamellae. So if we have a label for or a circle surrounding this area, it is the Haversian system or osteon. If you have a label in the area in between the Haversian systems, here or there, these are called interstitial lamellae. If you have a label for this blood vessel, it's better not to mention Volkmann canal because it is the anastomosing vessel passing in the Volkmann canal, as I cannot see the Volkmann canal, which is a calcified tissue in the decalcified compact bone section. So it's better to say anastomosing vessel passing in between two Haversian blood vessels. It's better than mentioning the name of Volkmann canal, or it's more correct. In the second picture also, as it is stained, so it is a decalcified compact bone. What we can see here? You can see here in this photo, you can see here the Haversian blood vessel. Haversian blood vessel. What are these dots in circles around the Haversian blood vessels? They are osteocytes in lacunae. So these are the osteocytes in the lacunae, and this circular part is called Haversian system, and these lamellae are called bony lamellae, and as they are present at the position parallel to the outer circumference of the bone, they are called external circumferential lamellae. So these lamellae parallel to the periosteum, here we have the periosteum, these lamellae parallel to the periosteum are called external circumferential lamellae, while these lamellae are the lamellae of the osteon or Haversian system. If we have a label for lamellae in between Haversian system, it is called the interstitial lamellae. So in this picture we have the periosteum, we have the external circumferential lamellae, we have the Haversian system or the concentric lamellae, and we have interstitial lamellae, and we have the Haversian blood vessel. This picture is unstained and it is very light blue in color, so this is the section of the ground compact bone. You should mention 2 points in this identification: the method of preparation, which is grinding method, and this method does not involve any staining, any fixation, any staining. So by this method you can only see the calcified tissue in the bone, and you never see living cells. So this is the ground, and it is compact because it has the regular arrangement of this Haversian system here, so it is a compact bone and not a spongy bone. Moreover, the spongy bone cannot be prepared by the grinding method as it is very fragile, so it will be damaged by this method. In this picture, you may have a label for this white or black circles. These are the Haversian canals and not Haversian blood vessel. It is a calcified tissue, not a living tissue. In the ground compact bone, we have the calcified tissue, so it is the canal which normally contains inside the Haversian blood vessel. But the Haversian blood vessel cannot be seen in this picture. We only see the room which is the Haversian canal. Each Haversian canal is surrounded by concentric lamellae of the calcified lamellae or calcified collagen, and we have in between these calcified lamellae we have the rooms of the osteocytes. So if we have a label here for this area, these are the concentric lamellae, and if we have a marked enlarged picture and we have a label for this black dot here or black line, it is the lacuna. And if we have a label for this area here, this area of that is present in between the Haversian system. This is the interstitial lamellae. These are the circumferential lamellae here, circumferential lamellae, and this is the Haversian system, and this is the Haversian canal. And if we have a label for this black line, it is the lacuna of the bone. Yeah, it's better not to mention the word osteocyte. It is the lacuna. So this is the picture of the ground compact bone. This picture is a very good exercise for the ground compact bone. What is the blue arrow pointing to? This is the blue arrow. So this is the Haversian canal. Haversian canal, Haversian canal, Haversian canal. What is the area that the white dotted lines are outlining? This area is the interstitial lamellae. They are the lamellae present in between the osteon or the Haversian systems. What are the yellow dotted lines showing? These dotted lines are showing the concentric bone lamellae. Concentric because they have one center and they are sharing this one center. These circles are all sharing one center, so they are called concentric lamellae. What is the area dotted by the green dots? It is the osteon or Haversian system. What the arrow, white arrows point to? The white arrow here points to the room occupied by the osteocyte. So this room is called lacuna. So this is lacuna, this is the Haversian canal, concentric lamellae, Haversian system or osteon, interstitial lamellae. Another nice picture for the ground compact bone. This arrow here is for the Haversian canal. This is arrow for Haversian canal. And these arrows here, they are denoting the concentric lamellae. These are concentric bony lamellae, and these concentric bony lamellae actually they are showing canaliculi. So it's better to mention the two words because you don't know which one is needed by the examiner. I can see here canaliculi and there and there and there, and at the same time these are concentric lamellae, so they are concentric bone lamellae showing canaliculi. But this arrow here is denoting the lacuna, and here these two arrows here are denoting the canaliculi. Here are the canaliculi radiating from the lacuna. So this area in between, you can say it is the concentric lamellae or the canaliculi. So it's better to say concentric lamellae showing canaliculi. Another picture for the ground compact bone. Of course, this black space is the Haversian canal, and this Haversian canal, and that Haversian canal. These are the concentric bony lamellae showing canaliculi, and this is the interstitial lamellae in between the Haversian systems. Another picture for the ground compact bone, we have here the Haversian. Here we have the Haversian canal, and surrounded by the concentric bony lamellae here, and these lamellae are alternating with the lacuna here, and from the lacuna we can see very clearly the canaliculi. Here we have here the canaliculi radiating from these lacunae. These minute threads are the canaliculi radiating from the lacunae. Actually, in a section of the bone, you may be asked about the function of these canaliculi. What is the function of these canaliculi? They are the passages through which processes of osteocyte can reach the processes of the neighboring osteocytes, so that the nourishment can pass from one cell to another very easily. This is another picture for the ground compact bone, but it is slightly colored, or it has a brownish coloration, but it is not stained. Here we have the Haversian canal, we have here the lacuna, we have here the canaliculi. All this rounded structure is the Haversian system or the osteome. In between the osteome we can have the interstitial lamellae. This is a picture for the decalcified. It is a stained, compact bone. It has Haversian system. In this section, you can see here, this area is the Haversian blood vessel. The Haversian blood vessel, here, this is the Haversian blood vessel, and this is the Haversian blood vessel also, and it is surrounded by concentric bony lamellae. These are the osteocyte in lacuna. You may be asked here about the feature, the LM feature for the osteocyte. It is oval, it is basophilic in staining. Nothing else can seen here in the light microscope picture in this slide. This circle is called Haversian system, and this area is called interstitial lamellae, and this area in between the osteocytes are called concentric bony lamellae. These fine lines are processes arising from the osteocytes, so that they can exchange with each other the nutrition, the waste products, as the matrix is calcified and no tissue can pass through it. You may be asked about one or two functions for the osteocytes, which are evident in all this picture. The functions, they are bone maintaining cells. Bone maintaining cells responsible for the maintenance of the bone. How? By formation both the organic part of the matrix and calcification of the matrix, which is the inorganic component of the matrix. And this is through deposition of calcium salts, as they have an alkaline phosphatase enzyme. Here, if you are asked about one difference between the osteocyte and the chondrocyte, you can say that the osteocyte, one osteocyte is present in its room, which is the lacuna, not evident here, while the chondrocytes can, as being capable of division, can present in groups. This is a very nice picture. You here can see the Haversian system here. You have a Haversian system here. This Haversian system is formed of Haversian blood vessel surrounded by concentric bony lamellae, and here we have the interstitial lamellae. Here we have the concentric bony lamellae, and the blue dots here are the osteocytes in their lacunae, or osteocytes alone, because lacunae cannot be seen in this section, which is decalcified. Here we have the blood vessels also here, also blood vessels here and there and there. All these are blood vessels, and you can see that they are anastomosing. We have an anastomosing vessel arising from this one to join a neighboring Haversian blood vessel. So this is also the ground compact bone, but you can be asked about the functions of the osteocytes, the LM picture of the osteocyte, the enzyme present in the osteocyte. This is for this picture. This is a picture showing the spongy bone. When you look at this picture, you can diagnose that we don't have here a regular bone marrow cavity. We have irregular bone marrow cavities here, and we have bony trabeculae, which are also irregular. No haversion system can be seen here. So this is the spongy bone. You may be asked about the size of the spongy bone. Of course, you all know that the small or irregular bones or the epiphyses of the long bones are all made of spongy bone. In this picture, you should diagnose the following. You should diagnose these cells on the surface of these bony trabeculae. These cells on the surface, they are free cells, so these are the osteoblast. You may be asked for one or two features that can be seen by the light microscope for the osteoblast. Of course, you can diagnose they are oval in shape and they are basophilic. Here it is darkly stained or basophilic in staining. And mention one enzyme present in them. It is the alkaline phosphatase enzyme. Mention two functions. They are the bone forming cell. They secrete both the organic part of the matrix and the inorganic part of the matrix, which is the calcium. They are responsible for the deposition of this calcium in the matrix due to their content of alkaline phosphatase enzyme. And once they are imprisoned in rooms called lacuna in the bony trabeculae, they are called now osteocytes. So these are the osteocytes. Inside the bony trabeculae, they are osteocytes. On the surface, free cells, osteoblast. One difference between this and that, it is more basophilic, less basophilic. This is not surrounded by matrix, this is surrounded by a matrix. And this red area is the bony matrix here, which is formed, of course, of the collagen of type 1. After that, we have the irregular bony cavities, which is full of the different cells responsible for hemopoiesis. This is the bone marrow cavity, and you may be asked about what the type of this bone marrow. It is a red because it is present in the spongy bone, so it is a red or active bone marrow. So we have here osteocyte, osteoblast, bony trabeculae or bony matrix, bone marrow. Nice picture for the spongy bone. Here you can see the irregular bony trabeculae, which is acidophilic in staining. And in the picture also you can see these irregular bone marrow cavities. So you will describe or you will diagnose structures in the bony trabeculae and in the bone marrow. In the bony trabeculae, on the surface, as you see, we have dark oval cells, free, not imprisoned in matrix, so they are called osteoblast. And inside the bony trabeculae itself, we have imprisoned cells. They are the osteocytes, which are responsible for the maintenance of the bone, and this is for building of the bone. Also, in the bone marrow cavity, you can see these blood vessels and these hemopoietic cells responsible for the production of the different blood cells. Nothing else here in this. This is a very nice picture for the spongy bone. Here we have in the spongy bone, we have the bony trabeculae. First of all, this is the picture with the original size. These are the bony trabeculae here, very evident. And in between we have irregular bone marrow cavities. In the bone marrow cavity, I can diagnose this large cell with single multi-lobe nucleus. It is the megakaryocyte. And we have the different hemopoietic cells. In the bone marrow trabeculae, in the bone spongy bone trabeculae, I can enlarge the picture more and you can diagnose what. Here in the bony trabeculae, here this is the red bony trabeculae, we have the osteocytes inside. While in the lining here we have a lining cells here, these cells here are the osteoblast. So the osteoblast on the surface of the bony trabeculae and the osteocyte inside the bony trabeculae itself. Now we have here also the megakaryocyte. You can see the megakaryocyte here with a single multi-lobed nucleus. This is another picture also for the spongy bone. We have here the bone marrow cavity, here in the bone marrow cavity here. All of this is the bone marrow cavity. It is lined by the endosteum, which contains the osteoblast. Here we have the bony trabeculae, which is formed of the acidophilic bone matrix, and we have these imprisoned cells, which are the osteocytes. So this is the endosteum, very thin layer, which is rich in osteogenic cells and osteoblast. Here we have the bony trabeculae containing the matrix as well as the imprisoned osteocytes. Another two nice pictures for the spongy bone trabeculae. We have here the spongy bone trabeculae or trabeculum, because it is a singular, and inside it we have the osteocyte, and on the surface you can see here two types of cells lining the bone marrow cavity. We have here the oval basophilic cells with single nucleus, which are the osteoblasts. This is the bony trabeculae. This is the bony trabeculae. These are with the star is the osteocyte. But this cell, which is very large cell, and it is multinucleated, and it is not so dark like this one, as it has an acidophilic cytoplasm. This cell is the osteoclast. This is the osteoclast, which is the bone destroyer cell or the bone eating cell. In this picture, you may have questions about the functions of the osteoblast. We have said them. Functions of the osteocyte, we have said them, and also the functions of the osteoclast. The osteoclasts are responsible for bone resorption by secretion of carbonic anhydrase enzyme, and this carbonic anhydrase will form carbonic acid that will dissociate to give hydrogen ions. The hydrogen ions will dissolve the calcium. Not only that, but they secrete also lysosomal enzymes, which will cause the lysis of the organic part of the matrix. So these cells will cause the removal of both the organic and the inorganic. The inorganic by the release of hydrogen ions, causing lysis, or causing the dissolving of the calcium, and the organic material is also dissolved or hydrolyzed by the lysosomal enzymes. Also, they have a very important role in bone remodeling during the ossification. In between these bony trabeculae, you can see these are the bone marrow cells and blood vessels in this bone marrow. Here in the other picture also, you will see the bony trabeculae and the osteoblast and the osteocytes here in the bony trabeculae. So we have the osteoblast, which are dark and with one nucleus, and the osteocytes in the bony trabeculae. Here we have also a covering on the surface of this spongy bone. It is formed of the periosteum. So in this picture we have the periosteum, we have the bony trabeculae, we have the osteocytes, we have the osteoblast, bone marrow cavity. This picture is a very nice picture. We have here 4 pictures. We will start by this one on the right side. Now, what we have in this picture? Actually, these are the osteoclasts. The osteoclasts are multinucleated. These are the nuclei present in the osteoclast. We have here 4 osteoclasts. Then we have this area which is called brush border, like a brush, and it is towards the surface of the bone. This is the bone, and this is towards the surface of the bone. At this brush border in the osteoclast, the brush border is the area in which there is a microenvironment which is of low pH, and lysosomal enzymes are released here so that bone resorption takes place. Accordingly, we have an empty space. Look at this small arrowhead. This empty space due to resorption of the bone is called Howe-Ship's lacuna. It is called here Howe-Ship's lacuna. So, this picture demonstrating these 4 osteoclasts. This is the bony surface, and we have here the multiple nuclei, and this cell is responsible for bone resorption and of course for bone remodeling during ossification. After that, we have another picture. We'll see it here on the left side. On the left side, we have also the osteoclast. Here we have the osteoclast. The cell is an osteoclast, characterized by being multinucleated, acidophilic cytoplasm, and the space around it is called Howe-Ship's lacuna. And the cause of this space is the release of the hydrogen ions and lysosomal enzymes. The hydrogen ions causes the dissolving of the calcium present in the bone, and the lysosomal enzymes cause the lysis of the organic part of the matrix. And these are bony here trabeculae. Another picture also we have here, this one. This one is also for a very nice osteoclast, as we see here, looking like a turtle. It has multiple nuclei, it has an acidophilic cytoplasm, and it is surrounded by this space, which is now very, very wide space, Howe-Ship's lacuna. And here we have the bony trabeculae. Again, we have another one also for the osteoclast. These are 3 osteoclasts. We have this bony surface where bone resorption takes place. So we have here, this is the bone, and we have also inside the bone itself, here we have this osteocyte inside the bone, but these are the most important feature in the photo, these osteoclast, and this is the bony trabeculae. And we have here other cells also on the surface of the bone. We have osteoblast. Inside the bone we have osteocyte. This is another picture also demonstrating the osteoclast. Acidophilic cytoplasm due to the presence of a huge amount of lysosomes, membranous organelle, and we have multiple nuclei, and they are related to the surface of the bone in the bone marrow cavity. Here we have the osteocyte inside the bony trabeculae, and we have here the bone marrow cells. Another nice picture for 3 osteoclasts. Here, multiple nuclei, acidophilic cytoplasm, and they are present on the surface of the bone, lining the bone marrow cavity. Inside the bony trabeculae, we have the osteocytes, and here we have a blood vessel in the bone marrow cavity and hemopoietic cells in the bone marrow cavity. It is a picture showing the stages of ossification in the epiphyseal plate. At first, here we have the head of the bone formed of spongy bone. And of course, it is covered by compact bone, which is not evident in the picture. Then we have, this is the epiphyseal plate. At first, we have an area of normal hyaline cartilage, and here the cells are discrete from each other, and this area is called resting zone. Then the cells begin to increase in number by mitosis. So we have columns of cells above each other. So here we have the discrete cartilage cell, and then we have the cells have proliferated in number, increase in number, and became arranged above each other like the coins. Then, after that, we will have this increasing in the size. This increase in size is called hypertrophy. And the increase in size, you may be asked the cause of this increase. The cause will be the accumulation of the glycogen and alkaline phosphatase enzyme. After that, these cells will die and leave empty spaces. And the cause of the death is the deposition or the calcification that takes place in the matrix and in the periosteum, so that no nourishment takes place and the cells will die. This death will allow the invasion of the undifferentiated mesenchymal cells and osteoblast to reach this area and form the irregular bony trabeculae of spongy bone. After some time, these irregularities will be removed and the osteoblast will form concentric lamellae of compact bone, and complete ossification and complete compact bone formation will take place. So this area is the resting, this is the proliferating, this is the hypertrophied, and this is area in which we have spicules or trabeculae of spongy bone is called stage of spongy bone formation or ossification. Here we have a trial exam. Here we are asked to identify the tissue. It is compact bone, and the method of preparation, the method is by grinding, and it is called ground compact bone. Identify one is the Volkmann canal, 2 is the Haversian canal, 3 we have the lacunae, 4 we have Haversian system or osteon, 5 we have concentric lamellae containing canaliculi, 6 here it is also denoting the canaliculi, so you can mention in 5 the concentric lamellae and in 6 it is the canaliculi. This is a picture for the decalcified compact bone. Identify the tissue, it is compact bone. The method is the decalcification. If you are asked about how decalcification takes place, it is by putting the bone in nitric acid 10% to dissolve the calcium, and after that the tissue becomes soft and it is fixed and stained. Identify 1 and 2. Here 1 is the Virgin blood vessel and 2 these are the osteocytes. Identify the structure labeled by the red. The red here arrow denotes the osteoblast, which are present on the surface of the red bony trabeculae, and it is free in the bone marrow. These are lining or present in the endosteum, outlining the bone marrow cavity. So these are the osteoblast. Green here the imprisoned cells called osteocytes. Blue arrow is the bone marrow cavity, and of course, as it is in the spongy bone, it is a red bone marrow. Blue arrow and red and blue star. Red star is the bony trabeculae, and it is of course here present in between the bone marrow cavities, and it is acidophilic, containing osteocytes inside. This is a very nice picture demonstrating the stages of ossification. Here, first of all, we have the stage of resting cartilage, where the cells are discrete. Here, the stage of proliferation, where the cells increase in number and became arranged above each other like the columns of coins. Here, in the stage of the hypertrophy, where the cells are large in size, and this is due to the accumulation of glycogen and alkaline phosphatase. And this is the stage where the cells die and the area is invaded by the undifferentiated mesenchymal cells and osteoblasts to form irregular acidophilic bony trabeculae. In between we have bone marrow. This is the stage of ossification and formation of the spongy bone. Another picture here. What are the green arrows pointing to? The green arrows here evidently are pointing to these large cells, acidophilic, multinucleated, on the surface of the bone, very near to the bone marrow cavity, and these are called the osteoclast. What is the name of the space where the yellow dotted line? Yes, this is space, which is the clear space on the surface of the bone related to the osteoclast. It is the how-shaped lichen, and you may be asked about how this space is formed, and I have answered that before. What are the cell types that the yellow arrow is pointing to? Here they are evident. This yellow arrow is pointing to this osteocyte present in the bony trabeculae. So we have an osteocyte imprisoned in the bony trabeculae. We have osteoblast on the surface. We have also on the surface a large cell. This cell is different from that in two forms. This is small, this is large, this is single nucleus, this is multiple nuclei, and this is basophilic, and this is acidophilic. This is another slide for exam. What is the name of the region outlined by the green arrow? This region, all of this region with the multiple fat cells, with the dots demonstrating hemopoietic tissue, with the large cells in between, you can see these are the megakaryocytes. So this is the bone marrow. Red arrows point to. The arrows here points to acidophilic, the bony trabeculae. Here we have the compact bony trabeculae here. And the yellow circles enclose, here enclose the Haversian system. If you are asked about the type of the bone marrow, as this bone marrow is present inside the compact bone, you can say that it is a yellow bone marrow, as it is present in the cavity of a compact bone.